Okay. This is Valerie Griffin. I'm a postmaster's nursing student for their FNP at Herzing University. This is Dan, my husband. Dan and I are going to be doing a neuro assessment. We're going to start with a couple tools down to my right here. First one we're going to do is the cranial nerve 1, the olfactory sense. As you can see what this is. I'm going to have Dan identify the smell for us.
Smells like lemon.
Which is correct. Next one is going to be his optic nerve for cranial 2. That one I don't have a Snellen eye chart. Dan was seen by his optometrist and he has 20/20 vision, but what we do have is the color blindness test here. I'm going to give him 2 ones to take a look at in the answers. I do apologize. We can't keep the cats out of the room or else they cry at the door. And I can't stop the kids from playing outside either, so if you hear extra noise, that's what's happening. What number do you see?
74.
And then what is the other number?
45.
Which is correct. So optic nerve 2, or cranial nerve 2, optic nerve is intact. So we're going to combine optic nerves 3, 4, and 6 for the fact that they are sequentially done by extraocular eye movements. So we're going to go do that now. So optic nerve 3 is your ocular motor, optic nerve 4 is your trochlear, and 6 is your abductans. Go ahead and follow my finger. We'll go up and to the left, back to the middle, straight to the left, back to the middle, down and to the left, back to the middle, up and to the right, back to your middle, straight to your right, back to the middle, down and to the right, back to the middle. So it's hard to see, but for me it's linear with no deviation. And then also, we're going to do cranial nerve 5, which is the trigeminal nerve. Thank you, Dan. This one's going to be facial sensations. So go ahead and close your eyes. Does it feel the same or different on each side?
Same.
All right. So we're good there. So let's go ahead and skip on to cranial nerve. What was it? 7. So it's going to be your facial nerve. So what I'm going to have you do is furrow your eyes like you're really, really angry. And then like you're super surprised, eyebrows to the sky. Puff out your cheeks real big for me. All right, perfect. And then show me all your teeth. All right. So I don't see any drooping and it's symmetrical on both sides. So let's do the acoustic nerve for cranial nerve 8. So we're going to start off with the whisper test. We'll do that here. These are going to be the words that I whisper. Blue pepper coin.
Blue pepper coin.
Go to the other side here.
Blue pepper coin.
That is correct. So let's move on to cranial nerve 9. So 9 and 10 are hard to discriminate against each other, so we're going to do them sequentially at the same time. So 9 is your glossopharyngeal and 10 is the vagus nerve. And the best way to do that is to open your mouth and say, ah.
Ah.
What I look for is the ability to make sound phonation, and then also that the uvula rises midline with no deviation, which was the case for Dan here. So let's move on to cranial nerve 10, which is your spinal accessory. So I'm going to have you push your forehead against my resistance here. Same with the back, and then on each side. And then this side. Perfect. So he's got equal resistance against all of each side for his spinal accessory. Last one is your hypoglossal, cranial nerve 12, which is now going to have you stick your tongue out at me. So you can see tongue is nice and midline and free from deviation. So let's go on to our cerebellar functions and our proprioception. So we're going to evaluate your coordination of your fine motor skills. So I'm going to have you follow me. I'm going to have you do taps. Tap your fingers really fast. Perfect. And then go ahead and sit. Flip your hands like pancakes really fast. Perfect. You can go ahead and stop. Last one, I'm going to have you lay on the bed here. We're going to do heel to shin. All right. So go ahead and drag your heel to your shin. Same with the other one. Heel to shin, same with that side. All right, go ahead and sit back at the edge of the bed here. So movements, it's hard to position the camera and bring it back. So movements were nice and smooth and accurate with no ataxia. So we'll do the Romberg's test next. I'll have you stand up. Maybe stand where I'm at. I'm going to tilt this back a little bit with your eyes closed. And go ahead and count to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Perfect. Go ahead and sit back down. So what I'm looking for during a Romberg's test is he swaying? Is he unable to hold his ground? Is he losing balance? And to which Dan was not losing any of his balance. So the camera may not be able to do this when we're going to assess his gait and posturing. So I'm going to open the door over there, let him walk through the hallway and walk back and assess his gait. All right, come on back, Dan. I'm going to take a seat here. So his posture and his gait are perfect with smooth locomotion. And there was no swaying or ataxia or stuttering or shuffling when he was walking around. All right, Dan, I'm going to have you go ahead. We're going to do your sensory functions now. So we're going to start with the superficial. I got my devices here. Well, let me know if you feel that it's soft with our cotton. Dull is going to be the top of the Q-tip, and then sharp is going to be the edge of the Q-tip. All right, keep your eyes nice and closed. Perfect. Let me know if it's soft, dull, or sharp.
Soft. 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 Soft.
And then feet.
Soft. 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 Soft.
I forgot to mention, let me know if you can't feel it at all. Okay.
Dull. 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 Dull.
That's pretty good.
Dull. 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 Sharp. 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 Sharp.
All right, so I would have to say that you have great primary senses. So now we're going to do vibratory senses. I don't have a tuning fork. So we're going to pretend with a real fork. What we're going to do here is if this was a megahertz fork, I would go ahead and strike it. It would vibrate. And I would put it all along Dan's bony prominences. Can you feel here? And I would ask if he could feel here. Smack it again. Grab on here. Keep hitting it so that he can feel. And we would go through all the primary joints. And then, including the ankles, we would go ahead and see if he could feel that vibration. And if this was a tuning fork, we would see for how long he could feel that vibration as well. Rationale behind that is it lets me know if he's got any peripheral nervous system damage or central nervous system damage, depending on where he can or cannot feel the vibrations. All right, so we're going to do perceptions of sense now. Go ahead and close your eyes. You're too good to me. Eyes closed. Put your hands out. All right, stick out your fingers. Okay. Which way am I going?
Up.
Which finger?
Thumb.
Alright. Which way am I going?
Down.
Which one?
Middle.
Alright, and then let's go ahead to the feet. Which way is it going?
Up.
And then which way is this one going?
Up.
Which toes did I assess?
Big toes.
Alright. Alright. Next one here, let's go back to my props. Let's do some astereogenesis. So I'm going to have you close your eyes again. Okay? I'll show the video what we got. We're going to put this. Go ahead and open up one of your hands, palm up. Go ahead. What do you feel in your hand? What object is that?
Key.
We're good. And we got this one? Which object is that one?
Paper clip.
Okay. And then last one. What's that one?
Coin.
Perfect. Alright, now let's go ahead and test your 2-point discrimination. Keep your eyes closed just like you are. Do your palms towards the sky on your hands. What part of the body am I touching?
Lower arm.
Alright. What part of the body am I touching?
Both lower and upper.
Okay. What part of the body am I touching?
Upper arm.
What part of the body am I touching?
Both lower and upper.
Alright. Let's go to the lowers. What am I touching?
Foot.
Which foot?
Right foot.
Which one am I touching?
Both right and left feet.
Okay. Which where am I touching?
Left lower leg and right foot.
Alright. And then which part am I touching?
Left foot and right lower leg.
Alright. 2-point discrimination was perfect. Bring you back up here. This name I butcher all the time is graphesthesia. So what we're going to do, go ahead and open your palms up again, Dan. Keep your eyes closed. I'm going to draw a pattern on each palm, and I want you to tell me what the pattern is. So, show the audience.
Eight.
That's correct. And then this one, show the audience.
A.
Absolutely. So positive graphesthesia. We're almost done, I promise. So now we're going to do the ability to discriminate different body areas. So I want you to go ahead and close your eyes again. It's very similar to 2-point discrimination. So what part of the body am I touching?
My right hand.
What part of the body am I touching?
Left upper arm.
What part of the body am I touching?
Right foot.
Okay. What part of the body am I touching?
Left foot.
Alright. Let's go on to our superficial and deep tendon reflexes. Alright, so I'm going to have you lay flat. We're going to do the abdominal reflexes. So with abdominal reflexes, there's a couple of reasons as to why it wouldn't work, and Dan doesn't qualify for any of them. One is obesity, unable to see the reflex by the umbilicus when you kind of tickle around it. Another one would be multiple pregnancies that goes ahead and it pulls that distialis recti, or instead of having a six-pack, those muscles are pulled apart and it just doesn't have the appropriate response. And then the bigger one that we worry about is a motor neuron dysfunction. So I'm going to go ahead and assess Dan's abdominal reflex. Go ahead and sit. Let me see. Go ahead and sit again. Here, touch the bed. Sorry, I know it's up and down. So unfortunately, I can't pull the camera with me, but what I'm looking for is a quick tightening in the reflexes where you kind of touch around the umbilicus itself. All right. So Are you able to kind of sit all the way back and show your feet to the camera? This is Dan's least favorite one. Alright, so we're going to do the plantar reflex. So typically, you would have the feet should curl backwards. Kind of like what babies, the Babinski test is that they kind of splay toe out. We don't really have that. We have the plantar reflex here. If this was absent, then I would truly worry about any higher function and brain damage if there was a complete absence of any plantar reflex, which is very typical in traumas with the cervical spine. So we're going to go ahead and do our deep tendon reflexes. Again, this is not what you would use. You would use an actual reflex hammer, but in COVID times, we must improvise. Go ahead and sit here. All right, let's do. So what I would expect is with the brachial, you put your finger right where you're going to do it, and you would tap. You would hope to see a little nudge. And then the brachioradialis, you'd hope to see a nudge there. You do bilaterally on each side. And sequentially, it would be 2 plus and expected. And then the trapezius, come from here. It would pop from there. Not the trapezius, the tricep. Same on this side. We do patellar, which would be shkabing. Same on this side. Thank you, Dan. So the Achilles as well. You can either have your patient sit on the edge of the bed and do one of these the polite way and kind of kick it, see if it moves, or if they're unable to cross their legs, you can have them lay flat and do it that way, but Dan can cross his legs. So you'd go from here and try your reflexes here, and hopefully you'd see a flinch. And then same on the other side. So we're going to say that Dan was 2 plus and expected. All right. So last but not least is going to be your ankle clonus. So what I want you to do, hold on, let me get it to your feet. Go ahead and flex, rapidly flex your feet. Perfect. Keep going, keep going, keep going, and stop. So that is going to let me know that he was able to control it. It was nice and rhythmic. Thank you very much. If it was positive, I would worry about upper lesions of the brain itself and then involving any of the motor pathways. So thank you, Dan. And thank you, everyone, for the improvisation during the times that we're in. Again, this is Valerie Griffin with Herzing University for our postmaster certification for NUR 609.